Good morning, everybody, and welcome to the MDUK session on care packages this morning. We've just gone live, so we'll wait for participants to log in successfully, and then we'll start. So we'll be with you in a couple of minutes, so just bear with us a second. Good morning again, and to those still joining, where people are logging in now to the live session on care packages. I can see the numbers going up still, so we'll pause for a couple of seconds while people join us, and then we'll start shortly. Thank you very much for joining us. Right, so I can see sort of numbers have leveled out, so I'll start us off. So thank you so much for joining us, and welcome to the first of two online seminars that MDUK is holding this morning as part of our Muscles Matter 2021 online seminar series. So we're building on the success of our 2020 series, and having taken an account of your feedback, the Muscles Matter seminars this year will become a regular feature in our calendar. We're hoping they don't replace our events where we bring people together live and in person, but they'll certainly run alongside those events, and hopefully we can host some physical get-togethers later this year. You told us that you found the seminars helpful and informative, accessible and easy to attend, and they're a good way to bring our community together at a time when we're needed more than ever to do that. So it's great to be able to run these again. And over the next 12 months, we'll run 2 or 3 sessions a month, focusing on a range of general and condition-specific topics. That include sessions you told us you found the most useful on research, practical and financial support, and on managing conditions. Each seminar will have a Q&A session at the end, which has proved to be a very sort of popular feature. A quick reminder that our helpline remains available to anyone affected by muscle wasting conditions. And do please contact us if you have any questions or are in need of any support. We can help you with the information and can either support you directly or point you to where you can get that support. The number to reach us on is 0800 652 6352, or you can email info@musculardystrophyuk.org. So in this first session this morning, we're focusing on accessing care packages, whether that's through social services or NHS continuing healthcare. It can be a complex process. So we'll provide you with some information about accessing various types of care packages to suit your needs and how MDUK can support you through that process. We'll hear from Neeru Naik and Beth Tingley from MDUK, and I'm delighted that we're also joined by Lucy Watts, MBE, and Jazz Singh. Lucy lives with an ultra rare and possibly unique neuromuscular condition and manages her own 24-hour care package of support through a personal health budget, and Jazz lives with FSHD and has a care package through social care. Before we begin, a note on how you can ask questions or make comments throughout the session. So many of you have submitted questions in advance, and we'll seek to cover these a bit later on. And we'd also like to incorporate some live input. And to do that, we'll be using the Q&A function, which you should be able to see at the bottom of your screen. So please click on that and type your question or comment, and I'll feed them into the discussion as we go through the morning. To help us manage the technical side of the event, we won't be calling on questioners to ask their questions directly. And any questions we don't manage to cover or that we don't know the answers to immediately, we'll seek to answer through our website afterwards, or if you contact us through the Q&A function with your email address or phone number, we'll come back to you if it's a specific individual inquiry. And then finally, a reminder that we're recording the session and that will be made available over the next few days. So I think that's all the housekeeping covered. So I'm delighted to hand over to Beth, please, to start us with our presentation this morning. Over to you, Beth.
Thank you. So hi, good morning, everyone. So yeah, today we will be talking about care packages, and on the next slide, I'll go through what we're going to cover this morning. So next slide, please. Thank you. So in this presentation, we will cover who funds care packages, how to access one, and what sort of options you have for managing your care package. And this presentation will mainly focus on what care packages are available in England. So if you do live in Scotland, Wales or Northern Ireland and would like information on care packages, then please do contact our team via the helpline or info email, as we'll be happy to help. Next slide, please. Thank you. So what are care packages and how do I request one? So a care package is there to support your care and support needs. Not everyone with a muscle wasting condition requires a care package, and you may only need to start thinking about a care support if your condition deteriorates and if you're finding your daily routine difficult to manage. So care packages can support with a variety of needs, such as dressing and undressing, personal hygiene, toileting, preparing food, medication, and accessing the community. And if you're thinking about exploring the option of getting a care package, it's a good idea to kind of start thinking about if you currently get any help from family or friends, and if there are things at the moment that you can't do without another person's help. Next slide, please. Thank you. So who funds your care package will depend on the nature of your needs. So your care package may be funded by your local social services, or it may be through NHS continuing healthcare. So social services care packages cover your personal and social needs, and it's likely that you will need to make a financial contribution to your care following a financial assessment, which I'll speak about in a little bit. And for continuing healthcare, the NHS can provide support to adults who have a complex primary healthcare need. And Neri is going to talk about continuing healthcare a little bit later on. Next slide, please. Thank you. So if you would like to access care support from your local social services, initially you will need to start by requesting a free care needs assessment. And you can do this by phoning the adult or children's social care number on your local council's website. Waiting lists for assessments can vary depending on where you live, but if your support needs are very high and you're at risk of injury without the support, you can ask to be assessed urgently. And also if that is the case, then obviously our advocacy team can help highlight that to the local authority as well. And at the assessment, you'll need to explain what sort of help you may need. So think about tasks that you can't do without help, any falls you've had at home, and tasks that you've stopped doing because they're too difficult to manage. Next slide, please. Thank you. So following the care needs assessment, a financial assessment will be completed. So the majority of people will be required to make a financial contribution to their social services care package. So what will happen is the financial officer will assess if you're receiving any benefits. So for example, personal independence payments, employment and support allowance, universal credit, or if you have a regular income, or if you have any pensions or savings. So there is some income that's not included in assessing what contribution you might have to make. So I know one of the kind of frequent questions that we get is, what if I own my own home? Does that kind of come into account in the means test? So it doesn't. If you're living in it, it won't be taken into account. And there's also kind of disability related expenses that won't be taken into account. So for example, kind of increased use of services. So if you have a higher heating bill or taxi costs. And then for the kind of disability related expenses, you'll need to provide receipts, invoices and bank statements for this. And I would say if you're not sure what kind of falls under disability related expenses, then do get in touch with us, or there's some quite helpful guides online which kind of outline what falls under disability related expenses. So that's all for me. I'm going to hand over to Neeru, and she's going to talk about continuing healthcare and the options for managing your care package. Thank you.
Thanks, Beth. So yeah, as Beth said, I'm going to talk about continuing healthcare. I will just give you a brief overview and then there'll be space for questions later. So continuing healthcare is when the NHS provides support to adults who have a complex primary health need and who need support with addressing or preventing a serious health problem from occurring. Eligibility criteria can include things like having ventilation or a complex treatment that only a district nurse can administer, for example. And there's actually no financial contribution that is required if you are provided with continuing healthcare. Because the continuing healthcare is administered through the NHS, it will need to be a health professional such as a GP, a specialist nurse, or a social worker that actually requests an assessment for you. And then once assessment is requested, an assessor from the CCG, so the Clinical Commissioning Group, which is the NHS, will complete an initial assessment. This is called a continuing healthcare checklist, and based on that, a judgment will be made on what support requirements you come under. Above is a list of things that will be taken into consideration, but this isn't by no means the full list. There will be two outcomes from the checklist assessment. You will either currently not meet the threshold for continuing healthcare and a full assessment is not necessary, or alternatively, you will be entitled to continuing healthcare and a full assessment will take place. Can I have the next slide, please? And in terms of the full assessment, so there's normally a multidisciplinary team that carries out the full continuing healthcare assessment. The multidisciplinary team will include at least 2 health professionals from different specialisms such as respiratory, neurology or gastro, for example, and at least 1 social care professional. And these professionals should really already be involved in your care, so have a clear understanding about your care as well. Your needs in the area listed on the initial checklist are then investigated in more detail, and each needs to be given one of the following priority scorings. So you're scored under severe, high, moderate, low, and no needs at all. If you're assessed as having at least 1 priority need or 2 or more severe needs, then you should, in practice, be eligible for continuing healthcare. Can I have the next slide, please? Sorry. So there's various options for managing your care package, which you can discuss with your social worker if it comes through. So this is now covering both social care packages and continuing healthcare. So there's various things you can discuss with your social worker or the CCG once your care package has been approved. So the first option is that you choose to have your care managed through social services or a CCG. So they will get an agency in place for you. If you choose this option, then this agency will arrange carers to cover your needs. They'll ensure that everyone's properly trained and they'll provide emergency cover as and when required. With this option, generally, you have less control over your care package and how it's spent. However, less control also means less responsibility. So for some people, it makes life a bit easier and not having to think about all the things that go around employing your own PAs. The other option is either a personal budget or a personal health budget. If you're funded through the continuing healthcare, you can receive a personal health budget in lots of different ways, including the option of direct payments. So that means either your social services or CCG will pay a budget into a bank account, and then you utilize the direct payments to pay for your own support. With this option, you've got more control over your healthcare and support needs and the independence to decide how these should be met. With more control, though, you do have more responsibility, as essentially you're classed as the employer. So you'll need to think about background checks, references, tax, national insurance contributions, and a whole host of other things. When receiving a personal health budget, you're placed at the centre of all decision making and the development of your care and support plan. And you should be given the option to manage your money, including options for either a direct payment, a notional budget, or a third party budget. So there are a lot of choices involved. Also, just to touch on this, some people do not meet full continuing health care as their needs aren't as severe. So some health authorities will actually provide you with a combined budget. So that will be jointly funded through social services and continuing healthcare. This is sometimes more difficult to get in place because some local authorities haven't done something like this before. So you can always come along to us and we'll be able to support with that. Next slide, please. So if you need to challenge a decision, you're unhappy with a decision, then do call our helpline or email our info inbox. And what we'll be able to do is liaise with your local authorities or the NHS, write letters or make phone calls just to try and get the best package in place. Thank you, everyone.
Thanks, Neil. Thanks, Beth. That was really a really sort of helpful overview of what is quite a complicated area. So definitely a key message I took away was contact the team if you have any sort of detailed queries. I'm about to invite sort of Jazz and Lucy to share their experiences. But before I do that, just a reminder that if you have any questions, do use the Q&A function and we'll come to them in a few minutes' time. Jazz, I think I'm going to come to you first, if that's okay, and invite you just to share a bit about your experiences. And I understand that you have a care package through social care, so it'd be great to hear a few words about your experience, if that's okay. And you'll just need to come off mute. Sorry, Jazz. Brilliant, thank you.
Basically, I have what you call direct payment with social services. And I began with direct payment back in 2006 when I moved out into my own place. I started off with agency care, but I thought that didn't give me much flexibility to do stuff on my own timing and so on. And then a year and a half later, I decided to employ a PA. So obviously I would have to be aware of the employment rights and so on, you know, working out PA wages, paying tax, etc. Which seemed quite daunting, but at the same time, there is help available. I mean, there are certain non-profit organizations that can help you with employment law and sorting out all the wages and tax payments and so on. So, yeah, that's not too bad, as long as you're aware of all the employment rights, etc. I started off with 48 hours of care a week, but back in 2017, my care was cut due to cut back in social care. So it went down to 38 hours a week, and now this, because of the lockdown, to cut my 8 hours a week later, because they say it was a lockdown and there's nothing open, so you're not using your leisure hours, etc. Which I didn't really, I didn't agree with. So muscular dystrophy are helping me to sort this out. Yeah, so overall, my experience has been okay, but lately it's been quite frustrating due to the social care cuts, you know, and cutting my care hours, because at the end of the day, my health is deteriorating. It's not going to get better, it's going to get worse. So, this is something that the social services should be aware of. And I've already told them, but they don't seem to listen. Yeah, that's it really.
Thanks, Jazz. Really appreciate you sharing your experience. That's really helpful. And yeah, sorry to hear you're having. I think that it's a common experience that people come to us with, is that kind of reduction in support, and that's certainly something that we're here to support people through.
Yeah.
Lucy, if I could come to you next. So I think you manage your care through a personal health budget, I understand. So it's maybe perhaps a slightly different experience. It'd be great to hear how sort of your experience and how you manage it, please.
Yeah, so I've been under NHS continuing healthcare since I turned 18. Prior to that, I'd had social care direct payments, and I'd also had an integrated personal budget, so joint funding between health and social care. But then as I moved to 18, my needs had increased. I moved over to CHC, and I've been funded by the NHS ever since. Under CHC, I've had both an agency provision package and I've had a personal health budget. I've actually had two personal health budgets over the years. I won't go into that story, but a change in need at one point meant we had to put in an emergency package with an agency. And then since then, I said to the agency, so the CCG, actually, I want to manage it myself. And so we explored a personal health budget. What's unusual for me is I have a very complex condition, a very complex medical need. So I'm not on ventilation, but I have respiratory treatments. I have intravenous medications and fluids and feeding via my Hickman line into my bloodstream, personal care, manual handling, hoisting, so on and so forth. So I need quite a lot of complex medical care. So I actually employ nurses as well as personal assistants. And that's quite unusual on a personal health budget to employ your own nurses. That's normally managed through an agency. But I'd had obviously my experience of employing staff right from, when my mum used to help me with my direct payments when I was a teenager, right through to before I got the agency. And I thought, well, actually, I've got enough knowledge and I've got the skills. I can go and find out what I need to learn. And I applied to the CCG and said, look, can I take that over? So initially they said, well, we'll move the PAs from the agency back onto the personal health budget, do it in a kind of phased approach. So I moved the PAs back over, took that back myself. And then over the next year or so, we built the plan for the nursing and I moved those over and I manage them myself. So I have 24/7 care provided by continuing healthcare. I have 16 hours a day with a registered nurse to provide for all my complex healthcare needs. I have 8 hours overnight with a personal assistant to support with things overnight, personal care, fetching and carrying, emptying my stoma bags and so on. And also then 6 hours of double up care with a personal assistant working alongside the nurse for things like washing, dressing, hoisting, which take obviously 2 people. I've really enjoyed managing my own care. I think I like the control that I get, the ability to make my own decisions, but also the ability to look after my own staff. So with an agency, I wasn't involved in the kind of management of the staff. And I found that quite hard because if you have an issue with a nurse, I'd have to go to the agency and get that sorted. Whereas when it's my staff, I can have a 5-minute conversation and it's done. And the other thing I struggled with an agency was when I wanted to change a shift pattern, say a nurse start earlier and leave earlier, or split the shifts slightly differently to what they split the shifts. It would take months of preparation just to get one shift change. Whereas now with my own staff, I have a word with the staff, the carer and the nurse that are coming to perhaps an event with me or to a conference or we're going away somewhere, have a word with them, organise it, it's all sorted. And I've then been able to bank the hours and make sure I've got the funding within my budget to allow me to do that. And obviously with my personal health budget, I use it as a direct payment. So I manage the staff myself, I do all the employment, I do all the kind of decision making. But I use a payroll company to manage kind of the payroll element, so I don't have to worry about paying staff, tax and national insurance. But obviously it's my responsibility to do everything else, including making sure that I budget accordingly for my care, spend it as agreed in my plan. But obviously there is a degree of flexibility and you can always go back to the CCG and say, actually, I've got this many hours unspent this month. Could I use it for X? And see if you can use that a bit more creatively. And I found that with the personal health budget, there's a lot more creativity you can use. And it's been a real benefit to me, to my family, and even down to, overnight, I don't have someone here who's clinically trained. So my mum kind of provides I live with my mum, so she can provide some background support if my pumps were to go wrong. But if my mum wants a night off, I can budget for that and get a nurse to come and do the night shift, and that's, sorted, and my mum can go off and do whatever she wants to do. But likewise, I can go off and do whatever I want to do. I can go to events, I can go and walk Molly, my assistant's dog, and do whatever I choose because it's me and my staff. They look after me. But equally, as their employer, I look after them. As part of my personal health budget, one way I was able to use funding creatively was I said to the CCG, could I have funded some aromatherapy massage? And when I was looking and doing all the support planning, I actually thought to myself, why can't I train my staff to do it rather than having to pay once a week for someone to come in? It's going to cost them, you know, 80 quid for them to come in. For the same cost, I could actually train my staff member to do that for me. So I said to the CCG, now this is really important for pain management. It will help stop my medication escalating. It will help stop me needing other support. And again, I had to provide the evidence, but they then agreed that actually that was an effective use of money. For the sake of £80, I could train each staff member in the aromatherapy massage, and then I can have that massage whenever I fancy it, if I need it, for pain management. And the other thing with the personal health budget is the training elements, so sourcing training. So I've been very fortunate. I use some basic providers for online training. I employ a nurse who provides some of the clinical training for the nurses and carers. And I'm also developing some e-learning resources for my own staff to help them, you know, get used to working on the package and get to know me. For me, personal health budgets, they're about greater control and choice and flexibility to make my care work for me, to have autonomy. And I think autonomy and agency is so important to people, to be able to say, this is my life, this is how I want to live it, and how can I have the best control over what I do. And ensuring the package works for me and my staff and I can look after them. But there's also that degree of flexibility, and I think, and creativity. And I think when you build your personal health budget, if you do get a personal health budget, make sure that flexibility is absolutely built in, and that you get things agreed as much in advance as you can, because then you've got the flexibility to spend it, obviously in line with your support plan as agreed with the CCG. And that's kind of my experience.
Thanks, Lucy. That's fascinating and really grateful that you shared that. I think a couple of things that leapt out to me were that it's fascinating to hear about the creativity and actually the positivity that you were able to approach the CCG with in terms of the spend. But have you come across anything they've said no to? What kind of things might you not be able to fund through a personal health budget?
So obviously anything that's not legal, you can't fund. So you can't pay off debts, and you can't spend it on, you know, things that are not exactly what a health need would qualify for. But there's not many things. I think for me, it's not so much what you're asking for, it's how you're able to evidence the impact. So people can get equipment funded, they might get supplies funded, so, you know, like continence pads, or they might have other equipment, you know, other supplies funded. They might have, you know, counselling, or they might have their assistance dog funded, or there's lots of different things you can get funded. There's not really a long list of no's, but it's about how it meets that health need. Is it an efficient and effective use of resources, and how does it make that person be have the best life they can? And it's about providing that evidence. So again, when I've asked the CCG about things, gone away, got the evidence, been able to say, this is what I want, this is what I think it will help, this is why it will help, this is the cost, and then they can obviously consider that and get that put into the package.
Brilliant, thank you. And I'll remove the spotlight from you shortly, but I was interested to hear the various different types of staff you mentioned. So I think you mentioned sort of nurses, carers, PAs. Would you mind just explaining a bit what the differences between those people, and particularly with PAs, how you recruit them?
Yeah, so I think a lot of tasks can be now delegated, as healthcare tasks can be delegated from a nurse to a carer or to a PA. So a lot of people are able to have their PAs do the tracheostomy care, their ventilation care. But actually at the moment, because of the nature of some of my needs, because of the intravenous nutrition and drips and stuff like that, that's not able to be delegated at the moment. So that's why I have the nurses. But obviously all my other needs can be met by both the nurses and the carers. So they're all trained to the same standard. The nurses just do that bit of extra medical care. But because I have so many IVs and drips, they're obviously here for 16 hours a day to meet all of those needs during the day. But with the PAs, I mean, actually, I find it harder at the moment to recruit PAs than nurses. It's I know a lot of people, you know, that have care packages will say it's really hard to recruit at the moment. So for me, word of mouth is a really good way of recruiting people. Social media, so Facebook, you know, Twitter, things like that. I also use Indeed. I find Indeed quite good, but I think it can vary area to area as to how successful it is. But it's thinking about different platforms. There's platforms like PA Pool, where you can find your own PAs or place an advert. Thinking about different ways you can reach people, but I think word of mouth is one of the best ones. If, you know, I've had one of my staff members has got other staff members to join my package, because she knew of people that were looking for work, and that's kind of how I often manage it, and how my staff often end up coming, or people have worked with me in the past and they've come back, or their friend knows about it, and also for me, because we can teach the staff. Obviously, the nurses have to be trained specifically, but if we can teach the PAs whatever they need to know, I don't need them to have prior experience. I just need them to be willing to learn and willing to do the job, and actually then we can train them and develop those staff to meet those needs.
Great, thanks, Lucy. I made a false promise in that whilst you were talking, a question's come through the Q&A for you as well, if that's okay. So Genevieve asks, what does the evidence look like? So you spoke about presenting evidence to the budgets. What kind of thing could that be?
So that might be, you know, so let's say the aromatherapy massage. So obviously I've gone away and thought, actually, that would be a really great thing to put on my package. How can I evidence that? So I got the kind of the cost side of things. So this is the person that will train my staff. This is the cost. Then gone to one of my medical professionals, so my palliative care nurse. I said to her, would she support that decision? Would she back up with me evidence? And the palliative care nurse then, when I applied to the CCG, wrote a letter and said, look, you know, as part of pain management, this is really important. Obviously, the hospice can provide some complementary therapy, but not to the degree that I would want it. So actually, and again, the cost benefit, you know, for the sake of, you know, the cost to train the staff and the benefit to me of being able to have the aromatherapy massage every day, as many times as I wish. So that's thinking about, you know, what it is, how much it's going to cost, but also what is the impact to you and who can you get to support that decision. So if you wanted to get a bed funded, for example, for a profiling bed, could your OT write a letter, you know, or if you've asked for a pay rise for your staff, perhaps because, you know, you're struggling to recruit, what is the going rate in the local area? Are there any adverts out that show similar level of need to you? What are they employing that staff member for? Looking at different, so it's about thinking about, you know, what it is, why you need it, how you can evidence that with professionals, with adverts, with costs, with, you know, different, you know, like interventions and how they work for other people, and then kind of apply for that. And it's about making sure that when your continuing healthcare nurse then goes to the funding body to say, this is what this was asked for, they can actually say, this is what they need, this is why, this person supported it, you know, can you agree it?
Great, thank you, Lucy. I did promise to take you off the spotlight, so I'll give you a rest briefly. We've had a question from Jenny around switching a direct payment from one council to a new one when we move areas. I think you've got an answer to that or some advice on that issue.
Yeah, no, we've had this come through the helpline and the advocacy service several times. So in terms of moving, the current package will not disappear until you've got the new package in place, but you need to start preparing before you move. So contact the local authority that you're moving into to start the ball rolling, and then they will also be able to give you more information on when they will do it. It will potentially involve a reassessment through the local authority, but you won't lose your current package until the new one is in place.
Great, thanks. And we've had a couple of questions in from Eamon, but one of them is around eligibility for blue badges. So the issue was that he applied for one but was told he was not eligible. Beth, I think you've fielded a few blue badge queries. So have you got any advice on blue badges?
Yeah, definitely. So blue badges is something we can help with. So usually the criteria they're looking at is if you experience difficulty with walking, if you use any aids to walk, or if you experience falls. So I definitely say to get in touch with us, because sometimes people do get turned down, and there is a process to appealing it, or you can reapply for one. So we can help with that. And I think Eamon also mentioned about free prescriptions and medical exemptions. So I think, as far as we're aware, with getting free prescriptions, you have to be claiming the certain benefits. So the benefits are kind of income support, income-based JSA, job seekers, universal credit, or income-related ESA. So if you're claiming one of those benefits, you should be eligible to get free prescriptions. But I would say definitely we can probably provide some more information on that, and have a little look into what the circumstances are to see if the eligibility criteria for that. Yeah.
Great, thanks, Beth. So yeah, definitely get in touch, Eamon. Beth, I'm going to stick with you. So we've got about 10 minutes left. So do keep the questions coming in. A question we had in advance was that someone would like to pay for a carer as they have a husband who is working part-time. So is that possible, Beth?
So yeah, it depends again on your circumstances. So obviously, generally the rule is if you have more than 23,000 in savings, then the council won't contribute to your care package. But with kind of partners, if you have a joint savings account, and you can prove that in your joint savings account their income is more or less than half, then we would advise you to do that with the local authority. So unfortunately, it's not a straight answer. Again, it kind of depends on kind of how much savings and assets you have, and if you can prove to the local authority in your savings account if you own less than half of the share, if that makes sense.
Yeah, thanks, Beth. That's really helpful. And kind of, we've also had a question came in that almost is the other way around. So that was around paying for carers separate to family, but often we're asked, I think, aren't we, about family members being it possible to pay them. So Neri, is it possible to employ a family member through direct payments?
Initially, you'll be faced with the answer no, because if they live in your same household, they're considered as your family. But you can negotiate this with the local authority and the CCG. And if you can evidence that they would be the best person to do this help with these care needs, then normally we have seen that local authorities do agree to it. But once again, if you have issues with that, that's another thing the team can help with.
Excellent. Thanks, Neri. Jazz spoke a bit around his package being reduced. So just interested in whether any sort of packages are for life. So I think we had a question advanced around continuing healthcare first of all, Neri. So if you're eligible for continuing healthcare, is that a kind of a lifelong award?
So it's really understood that if you qualify for continuing healthcare, you will have a condition that will always need support with it. So normally what happens is when you're first given a continuing healthcare package, it's reviewed in 3 months to see how it's going. And then there is normally an annual review following that. And what we do find with neuromuscular conditions are things do deteriorate or things stay quite static. So we haven't really seen anyone that's ever lost continuing healthcare. It's always an ongoing thing, but you will have to go through an annual assessment with the nurse assessor. But normally it isn't as taxing as the initial assessment because they have all the information. What they want to do is see what's changed and whether you need more support. And it's more likely that when you have a reassessment, you'll need more support than less. Very unlikely you'll need less.
Brilliant, thank you. We're entering our sort of final few minutes. I wonder if I could ask sort of Jazz and Lucy. I'll come to Jazz first. Just, I guess, one or two top tips about sort of looking back at the process you've gone through. If people are thinking about the need for a care package or receiving funding, what would your advice be? What was the sort of top tip?
I would say one of the important things is to be clear what exactly help you need, and when it comes to social services doing assessment, make sure you're absolutely clear with them from the beginning. If you have a deteriorating condition, to make sure they know that in future you're not going to get better, you're going to get worse. So you're more likely to need more care than you start off with, and yeah, that's it really.
Great, thanks, Jazz. And Lucy, same question to you. What would you've shared some really great insight, but yeah, one or two top tips for someone who's considering and sort of looking at how they can apply for funding and managing a care package, perhaps.
I think for me, comes back to evidence again. If you need turning, do a week's rota of how many times you're turned and who by. If you've got medical feed or feed going on, writing out your needs in such a way that it makes it clear. So when are your medication times? How are they administered? How long does it take? What do you have to do? Really being explicit with your needs in a way that someone else that's reading that can understand it. Because just saying I'm on peg feeds or I need hoisting or, I need turning occasionally, actually, couldn't you do a week in your life and just give an insight to people to how that actually plans out in practice? So what your life looks like, the care you need, what type of care you need, when you need it, how frequently. And I think that when I work as an also work as an advocate, things like a lot of that it is about the evidence. It's about being able to demonstrate your needs in a way that other people can understand. I think the other tip is to, you know, to be honest with, you know, them about what you need, not be afraid to ask for something, and to make sure that, you know, especially with personal health budgets, if you do want a personal health budget, how can you creatively meet those needs? You know, what would benefit your life that beyond just PA hours, just beyond just support, what else could benefit your life? You might not get all of it, you might be able to evidence all of it, but actually there's no harm in asking and having that conversation.
Brilliant. Thank you, Lucy. Thank you, Jazz. As ever with these sessions, we've had a really good question and quite a complex one come in at the last minute. So Beth, I think you can field this. The question from someone watching was, if you're saving for a deposit on a new home and these savings temporarily exceed the £23,000 limit, are you still forced to pay for your care whilst you're saving for that home? So Beth, I think you've indicated you might be able to answer that, or at least give a steer.
I would say, unfortunately, yes. I think it is quite an inflexible rule, unfortunately. If you do have over 23k in savings assets, you will have to contribute, unfortunately. But I would say maybe to contact your local authority and just see if there is any flexibility in that policy. But I believe it would be, yes, you would have to contribute.
Brilliant. Thanks, Beth. Neru, I think you've raised your hand. Unless we found a gremlin in the I'll come to you, Neru.
Just very quickly to add to what Beth has said, that if you have a financial assessment and they come back with a certain amount, you can question it. You can go back and argue a case to say, no, you haven't considered these things. Because what they do with financial assessments are they feed them into a computer program. So there's not much flexibility in there. So it's definitely worth going back and negotiating and coming to us to support your needs with that as well.
Brilliant. Well, thanks everyone. We've come to the end of the session. It's certainly flown by from my perspective. So a huge thanks to Lucy and Jazz in particular for sharing your experience and letting us put you on the spot. Thank you so much. That's been really valuable insight. And thanks to Neru and Beth, who I think hopefully everyone can see, definitely pick up the phone or drop us an email, and we'll be here to kind of help and provide that support. So thank you so much for your time. The recording will be available over the next few days to look back on, but yeah, definitely get in touch with the team. So without further ado, I'll thank everybody involved and say goodbye. Thank you very much. Thanks everybody.